Today, we're diving into the mental health crisis happening in South Africa's townships and rural areas. And we're going to see it through the eyes of a local psychology graduate who actually lives there. We'll break down the problems, which are deep, but also look at some real pathways to healing.
So, to really get the picture here, you need to know two key terms, Ikasi and Imakaya. These are the Zulu words for townships and rural areas. And what's really important to understand is that these are often places facing huge challenges. We're talking high poverty, not enough jobs, and very limited access to basic resources, especially when it comes to healthcare. And this is the voice that's guiding us today, Andilin Como. As a psychology graduate who's from the community, his view isn't just academic, it's personal. This quote really sets the stage. We're seeing this whole crisis from the ground up, right through his eyes.
Okay, so let's get into the heart of it all, the stories behind the silence. Because behind all the numbers and the data, there are real people, and their experiences show us exactly where the system is breaking down.
First up, let's talk about Sibusiso. His story is one of a promise that's been broken. He's a university graduate, full of potential, but now he's unemployed and really struggling with depression.
Now here's what's so telling about Sibuso's situation. The constant rejection from job applications has just wrecked his self-esteem. But here's the kicker. He feels like he can't ask for help. Part of it is pride, for sure, but it's also a simple, devastating fact. He literally has no idea where to even begin looking. His story is the perfect example of that 1-2 punch, the personal stigma and a complete lack of basic information.
And you see this pattern again in the story of Baba Mathembu, who's a father fighting an addiction.
Baba Mathembu is in an impossible spot. The stress of trying to provide for his family is just crushing him, and it's pushing him towards substance abuse. But the very community he's fighting for is also the thing he's afraid of. He's too ashamed to get help because he's terrified of what people will say. It just shows you how powerful social stigma can be. It can literally stop someone from getting the help they need to survive.
So what happens when someone does manage to seek help? Well, that brings us to the story of Umar Atoa.
After going through a heartbreaking miscarriage, Umar Atoa did something incredibly brave. She went to a counseling session, but she never went back for a second one. Why? Because the counselor just didn't get her cultural background, and on top of that, the language barrier made it impossible for her to really talk about her grief. Her experience is such a powerful reminder that just having a service available isn't enough. The care has to fit the culture and the language to actually work.
This leads us to another really important person in the community, an elder named Ugogo Uthobija.
Her story shows just how deep misinformation can go. When her son was battling mental illness, she thought it was witchcraft. She also believed that therapy was something for white people, not for her community. So, when her granddaughter was assaulted, the whole thing was just tragically swept under the rug. A child was forced to suffer in silence. It's a gut-wrenching example of how these cultural taboos become massive walls blocking people from getting help. And finally, let's look at two stories side by side that really nailed the biggest system-wide problems. You've got Usas Maria, whose son is clearly in distress at school, but she has absolutely no idea where to go for help. And then there's Tazama, who knows there's help out there, but she simply can't afford it. See? Together, they represent those giant twin barriers, access and cost.
So when you piece all of these stories together, you see this really grim picture. It's a vicious cycle, right? Untreated mental health problems, made worse by stigma and no access to care, just lead to more poverty and more trauma. And of course, that just makes everyone's mental health even worse.
It feels pretty overwhelming, doesn't it? But then we have to ask a really important question. Is it all just doom and gloom? The answer, thankfully, is no. There is hope.
So, how do we start building a better reality? Well, there are pathways to healing, and they all focus on 3 key ideas to break this devastating cycle.
This new way of thinking is built on 3 main things. First, telehealth. This is a game changer because it brings care right into people's homes, getting past issues of distance and even some of the stigma. Second, and this is so important, making sure the care is culturally sensitive. And third, creating support programs that are based in the community and designed for that community.
All right, for this last part, let's try something. Let's really use our imagination. Let's picture a different future for the same people we've just met. What would it actually look like if the system worked for them? Remember Sibusiso? Imagine if he could just pull out his phone and connect with a counselor who actually gets it, who understands his background, the pressure he's under.
Telehealth could just completely break down those walls of pride and access that were holding him back.
And what about Baba and Thembu? Imagine a support program right there in his own community, built for people just like him. A place where he could go without any judgment and get real help for his addiction and all the stress he's carrying.
In this better world, Umuradwa would find a counselor who speaks her language, who understands her customs, and who could genuinely help her through her grief. That one brave step she took would actually be met with real compassion and understanding.
Imagine Ugogo Uthobeja getting clear, simple information that replaces all that fear and misinformation with understanding. A world where she feels strong enough to get help for her son and her granddaughter, because she knows it's the right thing, the best thing to do.
And finally, just imagine a world where those huge barriers for Tozema and Sis Maria just weren't there anymore, where money is no longer the thing stopping you, and finding help for your child is simple and supported.
Look, this isn't just some nice idea. It's an urgent need. These stories show us that it is long, long past time to shatter the silence around mental health in these communities.
And this leaves us with one final big question to think about. Because this isn't just about one-on-one therapy. It's about the health of the entire community. So what does it really look like for a community to be truly mentally well? That's definitely something we're chewing on.